So some benefits before we get started are not a change. They are just a refresher so you understand how the benefits work. I try to pull the most utilized services so that you can kind of, again, have that refresher, because meeting with me once a year isn't going to mean you're an expert on all the benefits and remember everything that's in your plan. So this is an interactive forum, so I want you guys to ask questions as they come up. Those who are joining us online, feel free to enter those questions in the chat and we'll get those answered live for you. So let's start with the did you have a question to start?
I get confused so easy.
Yeah.
As you go along, I'd like to know what the difference is between this and United Health.
So
will you go over that later?
Yeah, we have to go over that in the 3 o'clock meeting.
Okay,
Yes, and we can send information to you outside of this as well, so you can get a proper comparison. But just for time's sake, we're going to go over the Regence plan for those who registered for Regence, okay? But we'll have United Healthcare at 3 o'clock. Is it 3 o'clock or 3:30? 3 o'clock, perfect. All right, so again, monthly premium is $0. Everyone is paying their Part B premium. That's either coming out of your Social Security, I'm sorry, 3:30, not 3 o'clock, 3:30. Thanks for verifying that. So everyone has to pay their Part B premium. High income earners will have to pay a higher amount, and we have what those limits are over on the table to the right. If you are joining us online, we'll send you what those income levels are, but everyone has to pay Part B. This plan has no additional premium. So the big thing that you guys want to pay attention to is your maximum out-of-pocket. This one is a slight increase on the in-network out-of-pocket. It's going up from $5,500 to $5,700, and out-of-network was reduced from $10,000 to $8,950. Remember, your max out-of-pocket is your stop loss. This is the most you're going to pay in a calendar year for all of your medical expenses, inpatient and outpatient. Any medications that you receive while you're in the hospital, while you're in a doctor's office will be included, but your prescriptions are not going to be covered in this max out of pocket. So that is a separate bucket. People call it the donut hole, right? And you do have flyers on your desks there with how the donut hole can affect you. Really, it's going to affect those who are taking a lot of medications or very expensive medications. So if you're taking medications that cost more than $4,000 a year, you're likely to be affected by that donut hole. So prescription drugs that you pick up at the pharmacy, again, don't count towards the maximum out of pocket, but everything else does. Okay? Less than 3% of membership actually hit their max out of pocket because the copays are designed to be so low, it's supposed to take you a long time to get there. And you'll see that reflected throughout the presentation. So I want to emphasize the importance of a primary care doctor. If you don't have one, let us help you get one. You want to have a good relationship with a doctor that can help manage your medications and your everyday needs. It's going to save you money. It's $0 copay to go see a primary care doctor. It's also a lot quicker to get into a primary care physician right now than it is a specialist. We have clients that are waiting 8+ weeks to get in with a specialist, especially as more and more people are coming into Idaho. It's harder for the schedule to allow for new patients or that many frequent visits, especially when it's something your primary care doctor can actually help with. So again, we want you to try and find an in-network primary care doctor so you can get that $0 copay, and we are able to help you with that. Specialists, they reduce that copay from $45 to $40, so a little bit of a savings there. But again, if you can try and do your routine follow-up with the primary care doctor, you're going to save. I want to remind you of the cost when you go into the hospital. This one's not a change, but I just want to refresh your memory on inpatient hospital coverage. When you're admitted, I joke that it's like an all-inclusive resort you never want to stay at. This copay per day, $325 per day, will cover everything that happens to you while you're in the hospital. Your room, your food, surgery, lab work, imaging, doctor consultations, everything they provide for you while you're admitted is included in that per day copay. You're going to be responsible for the first 5 days. So you'll pay $325 a night for the first 5 nights that you're in the hospital. After that, regardless of how long your stay is, the plan will pick up 100%. So if you're in 2 weeks, that's fine. You're still only paying for the first 5 days. Now, I like to reiterate a couple of things that will help you when you're looking at your bill. So This is an all-inclusive copay. If you believe that you were admitted into the hospital and then you get a bill that is itemized, that is something you want to look into, because sometimes we're getting clients that are actually being coded and billed as under observation status versus being admitted. So just because you're assigned a room doesn't mean you're formally being admitted. So it's important for you guys to read your summary of benefits or have these refreshers of what your benefits are so you can verify that your bills are correct. So if it looks like you're spending more than the 325 times 5 is, then probably you need to ask some questions. You can call our office. I would encourage, while you're in the hospital, that you ask, am I being formally admitted or am I under observation? Technically, the hospitals are supposed to give you a notice that say you are here under observation. It doesn't happen all the time. Where this can be a big hit as well, we had a client who had to go to a skilled nursing facility. So skilled nursing facility is when you don't need the hospital anymore, you're not quite ready to go home yet. Think of an inpatient rehab center. And essentially this gentleman was in the hospital for 5 days. Medicare has a rule that in order for them to pay and cover for a skilled nursing facility, you have to be admitted formally in the hospital for 3 midnights. So he was billed for 5 days in the hospital, but 3 of them were under observation versus being inpatient. So after he gets home and all the bills start trickling in, he's seeing denial, denial, denial. Very overwhelming, very scary to see such large bills. Took us a bit to fix that, but essentially it was a coding issue because he was receiving treatment while he was in the hospital. He was getting medication, he was getting care, he was not under observation. Wasn't like, oh, we had a surgery for you and we're just making sure everything is good and you don't have any complications. He was getting care. So it's not to blame the hospitals. Remember, there's a third-party billing company that they're using, and we just see administrative errors happen all the time. So what we're trying to do here is educate you, to empower you so you don't have that moment of freak out. And you know that this isn't something that's uncommon. We actually see it quite regularly, and we can fix it. You have about a year from the time that a claim has been filed to challenge that claim. You want to be as quick as possible on those. Okay, so please be on the lookout for those bills and read your explanation of benefits. We're going to talk about a little bit more of that throughout the presentation. All right, prescription drug coverage did change slightly. We saw an increase to the deductible by $50, so it's going to a $250 deductible that is only applicable to name brand and specialty medications. If you're taking generics, the deductible is not applicable. So you want to take generics whenever possible. Sometimes you can help that, sometimes you can't. But they were doing that so they could reduce the copays you can see on tier 4 and tier 5. So non-preferred drugs went from a 40% coinsurance to a transparent flat dollar amount, $100 copay. So we like that. That was a good add. And so again, they took a little bit from the deductible, adding a higher deductible so they can make that possible. And then we have the specialty drugs drop down a percentage. Sometimes we have to get creative with medications. Sometimes it's best to use the Regence plan, and other times we want to get some additional resources for you. In your bags, everybody has a GoodRx card that we've provided for you. Sometimes we can get a better price through GoodRx. You want to look online for the most current pricing because these can change anytime. It's not a locked in price for the year, and it varies by the pharmacy that you go. So some drugs are going to be cheaper at Walgreens. Some are going to be cheaper at Fred Meyer. You guys want to check those resources before you refill your prescription or reach out to our office. You should not assume that the cost that you are paying this year is going to be the same for next year. I see prescription formulary changes on an annual basis. So at the very least, we want you guys to send us your list of doctors and your prescriptions so we can verify that every year for you. And we can tell you, okay, these medications, this is how much it's going to cost under the Regence plan, or we were able to find some savings by using GoodRx. Sometimes I'm able to find manufacturer coupons, patient assistance programs through the hospital. We also have a local mail order service called Universal Prescription that legally and safely is able to obtain medications directly from the manufacturers in Canada, UK, New Zealand. We just helped a gentleman not too long ago get a 3-month supply for the cost of 1 month here in the United States using the Canadian pharmacy. So again, we have to get creative. I will say that Regence has a very robust formulary, and we've seen that a lot of medications have moved from, say, a tier 3 preferred brand drug to a tier 2, which is a huge savings because you no longer have a deductible that is applicable and you have a much lower copay. There could be additional savings if you use Regence mail order service as well. So if you're interested in finding out those details, we highly encourage you send us your prescription list so we can do that research for you on an annual basis. I want you guys to get in the groove and get familiar with reaching out to us on an annual basis. Even if you like your plan, to just verify your doctors and your prescriptions, then you can go into the new year with confidence and you have the information versus finding out and getting the surprise at the pharmacy. Okay. And again, you can call, text, email, or even live chat us on our website. We try to make it as simple as possible. You can text our main office number and we're able to respond very quickly. All right, let's move on to some other benefits. Hearing services. There's 2 different buckets for hearing. I want to just refresh everybody's memory that you have hearing issues that are medical related, right? You can have an injury that damages your eardrum. That's a medical service versus talking about hearing loss due to genetics or age, whatever it may be. So when you go to an ear, nose, throat specialist for a medical condition of the ear, just like we saw on the other screen, the specialist copay reduced from $45 to $40. They're highlighting that here. It's now only $40 because they are a specialist. Home and bathroom safety allowance was covered this year. They gave you $100 that you could use towards buying shower bars or a shower chair, just to, again, add some extra safety, especially if you're going to have a surgery or something like that, where they're trying to avoid some slips and falls. This benefit was not utilized, so they got rid of it. Nobody was using it. They're going to take that out and they're going to put that value and money in other areas of the plan. So if these are certain services that you guys like, I highly encourage that you use them, because if you don't use them, the insurance companies, again, are looking at utilization. They will pull benefits to reinvest in another area. So if there's something that you like, make sure you're taking advantage of all of the benefits that are included in your plan. All right, let's talk about lab work. So there's no change on the just standard HbA1c, which is for your diabetics. But we did see a reduction in all other lab tests from $10 to $5. Nice little savings there, especially for people who have to go in regularly for medications. I've got some people who are on warfarin, which is a blood thinner, and they have to go in routinely for blood work to make sure their levels are right. And so that can add up. So it's nice little savings there. Outpatient diagnostic procedures and tests, that's a very generic, broad explanation. So I like to use the example of going to a dermatologist and having a suspicious mole removed and being tested for skin cancer. So when they do that biopsy in the office, instead of it being $10, it'll be $5. Okay, so again, you're seeing they're taking some of the underutilized benefits. Yes, it looks like they're taking that away, but they're reinvesting in other areas where there is high utilization, high demand, to try and give you overall savings. We're doing our presentations a little different this year. We've collected the most popular questions that we get in our office, the most trending issues, and we're going to try and re-educate you on best practices. So we've got some little fun pop quiz questions. For those who are attending in person, you have a dum-dum on your desk. They are for you to eat, but we don't want to be dum-dums about healthcare. So that's our little theme today, is we're going to educate you and empower you with as much information as possible. So who ultimately is responsible for verifying that a doctor is in network? That's right. You guys are pointing to yourself. It's you. It is you. It is not the bubblegum chewer at the front desk who schedules appointments. She's not going to know. She doesn't know that Regence has different networks. She's just looking at Regence and going, yeah, I think we take that one. No. We want to trust but verify. Call, text, email our office. You can call the carrier. If you guys haven't created a member portal and registered online, please visit regence.com, www.regence.com. In the upper right-hand corner, they have a big register button. You just register with your ID number, and they have all these tools and resources available for you at your fingertips, including find in-network doctors under your specific plan. You can look up claims. You can pull your gym membership benefit. There's all kinds of tools, again, at the touch of your fingertips by going online. So whatever method is convenient and easiest for you, you have multiple options, okay? All right, let's get back into some benefits. We see another enhancement on the outpatient x-rays. That's going from a $15 copay to a $5 copay. So just bringing more value, more savings. Also, happy to announce that outpatient rehab services, physical therapy, occupational therapy, speech therapy, that's going down from $20 to $15. That may not seem like a whole lot of savings at first glance, but when you have somebody that's getting prescribed to go to physical therapy 2 to 3 times a week for several weeks, it adds up. So they heard that that copay needed to come down, and they made sure they did that for this year, which we're really happy about. And don't worry, if insurance is driving you crazy or the crazy world that we're living in, they've also reduced the copay to go see a counselor. So that is now going to be $30 instead of $40. Again, that can add up as well if you're going quite regularly. So we're just seeing overall reductions. Outpatient substance abuse. This is a big issue because we have a huge opioid crisis going on in our country. People are getting addicted to the pain medications. They're being prescribed after a procedure or for pain management. So if you need help with that, it's now $30 to seek help versus $45. So that's a pretty big savings there. Podiatry services are highlighted because we got to take care of our diabetics. Feet are really important. But remember, a podiatrist is a specialist. So just like we saw on the other screens, it went from 45 to 40. So there's a savings there. If you need to have a surgery, you are going to save when you go to an ambulatory surgical center versus the hospital. So for those who don't know what a surgical center is, I want you to think of Treasure Valley Hospital. They have no emergency room. All they do are outpatient procedures. I want you to think of Hollingshead Eye Center. That's always a common one that I get asked about. They have an in-suite surgery unit if you were to go in for cataracts or anything else, LASIK. LASIK's not covered by Medicare, but I'm just giving you an example that there are services they can provide in their office without you going to the hospital. So it's a savings. Instead of paying $225 like you did this year, it will be $200. And there's another slide that I have about what the cost is when you go to the hospital coming up. If you're going for wound care, I really like that Regence separates out the services because not every company does. Some companies just go, oh, you're going to get a surgical service, so we're going to charge you the full copay. Regence is saying, no, if it's wound care, we're only going to charge you $40 versus actual surgery copay. So we like that. If you go to the hospital, it's $275. So you're going to save $75 by going to a surgical center versus going to the hospital. You want to ask your doctor if they have privileges at a surgery center, and you want to ask which facilities they do, and we want to verify that those are in network prior to you going, okay? And again, wound care is a reduction from 45 to 40 at the hospital as well. COVID hit a lot of people really hard. So pulmonary rehab has been an increased service that we're seeing, and they're reducing that copay from 30 to 20. So if you've had post-COVID complications that affect your lung function, this could be a really good benefit for you. Yeah. So that one, a lot of people didn't know about before, but like I said, COVID really brought that one to light as a priority. Let's get back into some best practices, shake it up a bit. How can you guarantee your claims are going to be paid? We get this question all the time. People will call us and be like, hey, I want to know how this is paid. I want to guarantee that this is what you're telling me is good. That's how it's covered. Let me remind you what we do. We provide the information about how coverage works. I can look up the service and tell you how it's supposed to be paid on your contract. But who ultimately is going to determine who's going to pay? It's the insurance company. So what you want to ask for is a pre-authorization from your doctor's office. There's a lot that goes into it. You can say that you want a surgery, but the insurance company has the right to ask for medical justification prior to approving that. So a pre-authorization includes the procedure codes that the doctor wants to perform prior to performing them. And they should be including chart notes and imaging records to support why that surgery is needed. So sometimes the insurance company is going to come back and say, now hang on, before we pay for the big, expensive, invasive surgery, let's try physical therapy. Let's try some medication. Let's try X, Y, and Z prior to that. And then so you have to go through what's called step therapy. Let's do the little stuff before we pay for the big stuff. When you get a pre-authorization, you will receive in writing from the insurance company an approval or a denial. If there's a denial, there's an explanation as to why. The responsibility for the pre-authorization is on your doctor's office to complete and submit to the insurance company. So it's a request that you would need to make to your doctor's office. I'm not saying do this for office visits, lab work, image, basic x-rays, but I want you to think of the big expensive stuff. Surgeries, major imaging like MRIs, CT scans, PET scans, because those can be a couple $1,000s. So remember, the goal is to be proactive, not reactive. These are ways that you can get a smooth claims experience, a smooth overall experience on your plan to make sure your benefits are working the way that they're supposed to. And that just, again, when in doubt, request the pre-authorization. That's what that is intended for, is to give you those guarantees. So we can tell you how the benefits are supposed to work, but the responsibility of who provides the service and who's authorizing the service is going to be between the doctor and the insurance company. All right, let's get back into some fun stuff. None of these are changes. It is just a refresher of your member extras that are built into the plan that are not fully being utilized. Guys, I talk to a lot of clients throughout the year, and every year I get people tell me, oh my gosh, I forgot to use my over-the-counter benefit. You're leaving money on the table. You have an over-the-counter allowance of $40 a quarter to spend on things you're normally buying at the store. Cold cough allergy remedies, vitamins and supplements, your oral hygiene needs, including toothbrushes, toothpaste, all kinds of stuff. Yeah.
I think it's a hassle because it doesn't explain fully how to use it. I know you have a card or something.
Mm-hmm. So you can go in store to a Walgreens, to a CVS, and use it like a debit card. On the sticker, the price tag, it says OTC approved, so you know what items are qualified. I just went to Walgreens the other day, pick up a prescription, get some vitamins because we're going to be in flu season here, so I'm stocking up on my stuff. And as I'm going down the aisles, I see on the price tags OTC approved, which is so nice. So instead of, going online and doing an order and waiting for it to come to you, use that card. Whenever you go to the store, look in those health areas and you're going to see, so like a Walmart, how they have the health section where all the vitamins are, then you're going to see OTC approved, and it works just like a debit card.
So when you go through a check stand,
Mm-hmm.
do you give that person the card before you pay for it or something?
Right. So just like you're a normal checkout, you're going to put your items now. Don't throw your candy bars in there and your mascara and all the other things. You want to have a separate transaction just for your OTC items. Okay. Yes.
You don't have to have them all separate. Just get your pharmacy items and get whatever else. Put your OTC card in first. It will pay for what it'll pay for. And then you put your other card in and they'll pay for the rest.
Oh, so the stores are getting even more advanced with that. That's awesome. So we were just told in trainings that, hey, you're not going to be able to use it for everything. So if you want to just put, those little stopper things that they've got in between. I didn't realize that they have people that are that smart to figure out the difference. Cool. Awesome. Yeah.
Do they have an expiration date?
Yes, so it's a quarterly benefit, and if you don't use it within the quarter, it's not going to roll over into the next quarter. So you must use the $40 within that 3-month span, because whatever unused money you didn't take advantage of will not carry over into the next quarter. Okay, so it's truly $40 a quarter, and they automatically will reload that for you. Okay, so don't leave money on the table. If you're paying for these things out of pocket, there's extra savings that you guys are missing out on. So we want to make sure you take full advantage. This next one, everybody always goes, what the heck? I'm never going to use this. Virtual companionship through Pop-Up House. You hear virtual companionship and then people check out. Hold the phone. It's more advanced than you guys think, and people are getting very creative with how they're using it. So there are some in-home services that are available. So the name suggests that it's just a companionship service. And yes, you can use it as such. You can use it to have somebody come to your home, or you can speak with them virtually, through your laptop or iPad, just to have conversation, to play games, to watch movies with. But you can also use these services to have them take you to and from your doctor's appointment, take you to and from the pharmacy, help with light housekeeping, help with meal prep, help with organization, tech issues. They can help with that. For people who've never created a member portal or don't know how to navigate the Regence member portal, they're trained on how to walk you through that and how to set it up on your behalf. We have one client who's a missionary, and she had to create a PowerPoint presentation for her mission work, and she didn't know how to use PowerPoint. She looked up what the cost of the classes were, and it was really expensive. So she uses this benefit to have them put her PowerPoint presentation together for her. Perfect. They even can walk your dog. I don't know why you would have somebody else walk your dog. We should all be walking, but that's okay. If you had an injury and your dog needed out, that's a great one that you can rely on. So there's extra built-in services. Remember, Medicare doesn't pay for true in-home healthcare services where they cook and clean for you. This is as close as you're going to get. And they enhanced it. From last year, it was you get 4 hours in a month. So 4 visits up to an hour. Next year, it's 48 hours per year. Still have an hour in each visit, but you get more hours, which is awesome. So remember, take advantage of these, because if you don't, they're gonna go away. So we want you guys to use them. Personal emergency response system. Not enough people are using this one either. So let's talk about that. You get the device and the monthly monitoring service for free. You do not need a landline. It is a 2-way communication device, GPS monitoring, fall detection, and waterproof. You do not need to be like the ladies in the Life Alert commercial. Help, I've fallen and I can't get up. Again, we have clients who are getting very creative with how they're using it. So the couple of examples I want to use. One client is an adventurous mountain biker. He likes to go out into areas where there's no cell service or little cell service. So he and his wife have this deal. If you're not home by this time, I'm sending in the cavalry. So we're going to hunt you down. Now he takes this device with him. It has the fall detection. If he's not responsive, they're going to send first responders to him and call his wife, who's on the emergency contact list. They both have peace of mind. He gets to do his thing. She gets to sleep well at night. It works well. We have another client who lives alone. Saw peeping Tom in the window, didn't want to overreact, call 911. So she hit the button. She said, hey, I'm a little freaked out. Can you stay on the line with me? But if I scream, call everybody. Send everyone to my house. And she just uses it like a personal security, because ADT is expensive.
So it's a little device?
Yeah, you could wear it on a lanyard. You could tuck it into your pocket. So it doesn't have to be like this big, obnoxious thing that's super visible. You can have it to your discretion.
So do you put all your medications on that if you're not conscious or anything? and they know what your medical history is or anything?
You know, I've not had that question. I'd have to find out. I know you can set up your emergency contacts within that so that they can reach out to whomever, but I'm sure upon registering for the device, there's a phone number that you call. They'll ask certain questions to complete your profile so that they can give you the best support possible. But I'll have to get specifics on that. That's a great question. Can you write that down for me, Heather? Thank you. So we'll reach back out and we'll put a little Q&A together and send that out to everybody so we can get that answer to everyone who's interested. Thank you. But yeah, I want you guys to use these benefits because they're no charge. They're really helpful resources. And again, they're not just for the old decrepit lady who fell and can't get up. And we have had situations where a client had surgery and yes, they had family and friends stay with them and help them. But you know, we had one instance where they went out to go run errands, go get groceries. And after surgery, you know, they went to go get up to use the bathroom or whatever, lost feeling in their legs and hit their head on the nightstand and were unconscious until somebody came home. Things happen. You just don't know. It's nice to have those things available for you. And you can use it however you think is best for your lifestyle. I will encourage you though, please take it in the bathroom because most falls happen in the shower and it is waterproof. And that's a really uncomfortable position to be in is, you know, you're in the shower and then something happens and then you're stuck and you're just screaming, waiting for somebody to get you and the water runs cold. You don't want to do that. So take it with you. No harm, no foul. You just have it as a backup and again, peace of mind. Okay. So we want you to use these services. There's no changes to them other than the increase on the Papa Pals, which just got better, but we want you to use them. Same with the mom's meals benefit. So you have a meal benefit post-discharge after you've been in the hospital for at least 24 hours. The Regence will look up your claims history and they can see, oh, you were in the hospital. All right, we're going to approve to have almost actually it's a month worth of meals delivered to your home. And then if you have chronic health conditions like diabetes, they will also help deliver meals to you as well. It's a little bit more than that. It's almost 2 months worth of meals for the chronic health. So they'll look at your prescriptions and see if you qualify for the chronic health conditions benefit. But the idea is to support your wellness. And part of that is making sure you have good nutrition. We know you're not going to feel 100% after coming out of the hospital. Probably don't feel like cooking, but the last thing they want is you to reach for the phone and call up Domino's or get a Big Mac from McDonald's because you don't want to cook. They want you to have a nutritious meal that will help support you healing as quickly as possible. They can follow any dietary needs or restrictions you or your doctor have, and they will work out a schedule so not all the meals are delivered at once because nobody wants to find space in their freezer for 112 meals. And you can use them however you want throughout there's no monitoring on that. So if you guys want to share your meals, you're able to do that within your household. It's just nice to sometimes not have to cook. And groceries are really expensive now. My goodness, everything is expensive. So take advantage of the savings. Let's also remind you guys that you have your vision benefits included on here. There's still 2 buckets for vision as well. You have a medical bucket like cataracts, glaucoma, macular degeneration. Those are medical conditions of the eye. You're not going to pay for an exam there. Just like you won't pay for an eye exam to check your prescription to see if that needs to be adjusted in any way. Lenses are covered, but they will cover the prescription portion of the lens, not the enhancements that we like to add to our lenses. So if you like the anti-scratch guard, the anti-reflective coating, the transitional lenses that turn into sunglasses when you walk outside, those are going to be extra and out of pocket. A lot of times people will still buy a standalone vision plan, which can be purchased anytime throughout the year to help cover those costs. So sometimes people still need to buy extra if they're finding that their out-of-pocket expenses are still really high even after using this benefit. My recommendation is you get a itemized breakdown from the optometrist office of what the expected charges are for all of those little enhancements that you want. Give our office a call. Let us compare that to an insurance plan and see if the extra premium makes sense. Sometimes the cash price at the doctor's office is better, and sometimes insurance is better. But if we have those numbers to compare, then we can actually show you where the savings is or isn't, okay? And also, let me remind you, the allowance for frames or contacts is $100 per year. So that's your limit. Let's go over some best practices. Every year that we send out the postcards about these meetings, I want you guys to get really comfortable with these meetings because we're going to do them annually. We are using essentially the lead time because annual enrollment doesn't start officially until October 15th. Medicare won't let us start talking about the next year's plans until October 1st. So we use these first 2 weeks to tell you how your plan is changing. How do you know if you want to change your plan if you don't know how your plan is changing to begin with? That's the importance of these meetings. We want you guys to get familiar with them. And people always ask, how do I know I'm on the best plan? They see all these plans on the postcard. They're like, well, which one should I do? We got it figured out for you. Here we go. Are your doctors covered? Probably not a bad plan, or probably not a good plan, I should say, if your doctors aren't covered. So let's verify that. Same thing with your prescriptions. Let's verify your prescriptions are covered. What services are you going to utilize the most? So if I put all the plans on a side-by-side comparison, they're all going to have a lower copay somewhere in different areas. They do that to attract certain audiences. So instead of getting the analysis to paralysis because there's so many options and I like this over here and I like this over here, let's prioritize and focus on what your particular needs are and what services you're going to utilize the most. Are you using all your benefits? I just talked about that. A lot of people aren't using their over-the-counter. They're not using the dental. They're not using the vision. You're leaving money on the table. You're thinking you're overspending when you actually have built-in savings on the plan. Make sure you familiarize yourself with all of the potential benefits that you should be using. Do you feel any cost burdens? Vocalize that. I'm getting killed on this prescription. I'm getting killed. We had a client, he let me know, hey, I go through radiation and it's very expensive on my plan. I have to pay 20% every time I go. Okay, let's look at it. Let's see if we can find another plan that has a reduced cost in that area. We found a plan where it was only $65 a visit. Thrilled. He was able to afford continuing his treatment. He was actually considering not going through radiation because the cost was too expensive. Let us know where your most needs are and where your biggest expense is. So again, we can prioritize those services when we do a true comparison across the board. All right, let's go back into, I already touched on the surgery benefit, so let me go on the hearing. We talked about the exam on the other slides, but there is a hearing aid benefit through True Hearing. You have to use True Hearing providers to get this benefit. We'll get you that phone number. And if you are interested, you just call that number. They schedule an appointment with one of their True Hearing providers, and they will help you find a model that works with your needs. They have two models, an advanced model for $6.99 per hearing aid and a premium model for $9.99 per hearing aid. These will include warranties, adjustments, additional batteries if your model is applicable to that. So it's important that if you want some savings, because hearing aids can be very expensive, that you're using their particular network. And we can't really tell you which model you should go with because that's going to be something between you and your audiologist to decide. But there will be a few options for you to choose from. People have compared this to Costco. Some people say they really like the difference in the technology and they do find that the savings is very valuable. I just encourage you to do that comparison and just make sure that you're getting the best bang for your buck and what your needs are. Let me remind you of dental. So dental is built into the plan. You have a $1,000 benefit limit towards preventative services and imaging. So you get your cleanings, exams, and x-rays, and then additional imaging for, if you have an issue, oh, I'm experiencing pain, I need imaging. It's really not a whole lot, but remember, you're not paying anything for the plan. It's just built in automatically. What Regence does offer during annual enrollment period, which is October 15th through December 7th, there is a buy-up option, $22 a month for an additional $1,000 of dental coverage for comprehensive services, which would include your fillings, extractions, root canals, crowns. I'm not saying you should go with that. I'm just saying, look at what your needs are, what your history is. If you just go in for cleanings, you're probably fine. You can add dental coverage anytime throughout the year. Just let us know what those dental services are. Ask your dentist office for a treatment plan, and we can compare that to the individual market and see if it's worthwhile, again, to buy a dental plan or to pay cash. So that can vary, but it is built in, and we want you to at least take advantage of the preventative services that are available to you and get your imaging done through this benefit. Regence, Medicare is always going to be primary. So if you buy a secondary plan, they will be the secondary insurance. So this will pay first, and then whatever is not covered, your secondary plan will pick up the difference. Okay? Again, just a reminder of the benefits. You have a fitness benefit. Bodies in motion tend to stay in motion. So you have the option of going to a gym using Silver and Fit. Again, we want you to use the member portal at regence.com because you can log in, select your gym of choice. It gives you a printable code that you take in and you hand to them, so they bill Silver and Fit. They don't bill you. You can pick multiple gyms. I have this client, she's adorable. She brags every year, I go to 5 gyms a week. I go to the YMCA for the aquatics class on Monday. I go to Curves for Women on this day with my girlfriends. I go to Axiom for the Zumba instructor on this day. She does it all. Perfect. You guys can try multiple gyms. I'm not saying you want to, but in case you were curious, you can. It's not limited to one. And if you don't like going to the gym, or you're just worried about health issues, just because, again, we're still living in a COVID world, there's a home fitness kit that you can buy once a year. Not buy, it's included at no additional cost. You just have to order it through the member portal. All right, this other benefit, underutilized, I want you guys to know Regence really tries to get creative and go above and beyond in supporting their members. So they're going to give you palliative care and support. If you or a family member are going through a health crisis, you're the caregiver or somebody is having to provide you with caregiving services, they have a full team of support that's there to counsel and support you. If you need resources, if you need direction, most of them are registered nurses or have some sort of background that is going to be very valuable for you. So they know that caregivers give all of themselves and there's nothing left for them. So this is a way that they're trying to support you or your family when you're feeling overwhelmed. So it's no charge. You just call in. Hey, this is the situation. They'll get you in touch with a personal care manager that will be assigned to you specifically. You have a direct contact, and they're now your go-to best friend. They're going to check in on you. They're going to help you schedule appointments, find you all the support that you need, whatever it is that you got going on. Okay, so extra benefits. Let's go through some pop quiz. Again, everybody received a summary of benefits for this plan. Familiarize yourself with the summary of benefits. Keep it in a location that you can just go to anytime and refresh your memory. It's almost like a food menu for your medical services. So it'll say, okay, your copay for surgery is $200. Any service you're interested about, it's going to be included in that summary of benefits. This is crucial for you. You'll know what you're going to pay before you go. And then again, you know what to expect when the bill comes. So if the bill says $300 and you were expecting a $200 charge, ding, 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 I have my summary of benefits. Something's not right. I need to call Shores Insurance. I need to figure out what's going on. Before you pay your bill, please don't pay it till you receive your explanation of benefits from the insurance company. A lot of times the hospitals and doctors' offices are sending you a bill before they even got the claim processed by insurance or before they even billed them. And what's misleading is it'll say insurance adjustments on your bill. So to the naked eye, to anybody who doesn't do this for a living, you're going to go, oh, they applied my insurance benefits. It's a guesstimate of what they think your insurance is going to charge. Many times our clients are overpaying and then having to fight for a refund. They're quick to take your money, not so quick to give it back. So wait to pay your bill till you get that explanation of benefits. The insurance company is required to snail mail them to you. You can also, again, in your member portal, pull them down digitally. You'll get them faster from your member portal than you will in the mail. So that explanation of benefits is going to tell you what services they were billed, so you can double check that those were the services that you got, how much they paid, and what your responsibility is after your benefits have been applied. And unless that number at the bottom that says patient responsibility matches what your billed amount due is, that's the only time you should be paying a bill. They have to match. If you need help because sometimes they are a little confusing and overwhelming to read, you call our office, send us a copy. Remember, we said you can text our office. You can also text message pictures to our office. Just snap a picture, send it. No problem. I can look at it in 2 seconds and go, oh, I see what the problem is. Most of the time. Sometimes it's a little bit of a detective work. But for the most part, it's very helpful to have those. Did you have a question?
Oh, no.
Oh, just scratching your head? All right. I got a quick eye. So if I see any sudden movements, I'm like, who wants to know something? So these are resources and tools that are going to be very helpful for you. We want you to take advantage of those. And one other point, when you are in your member portal, it can be a little confusing. Sometimes we'll see 6 different claims for the same date of service in the same service. Deny, 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 pending. So keep in mind, sometimes the doctor's office does not send all the details they're supposed to. They use the wrong codes. They forgot to send the chart notes. They forgot to send the imaging records. And the insurance company is going to keep denying that until they get the right information. That does not mean you guys still have to pay that bill while the claim is pending. You guys have insurance so that they pay first, not so that you have to pay up front and get a refund later. So if your doctor's office is chomping at the bit, pay us, pay us, pay us. I will pay you when you do your job right and you get the bill sent over to the insurance company correctly and you've provided all the information that they requested. I have insurance, so they pay the majority, the lion's share, and I pay the small portion. I'm not paying you guys more than I'm supposed to and fighting you for a refund. And if anybody gives you any guff, you call me. I got a pair of pink boxing gloves I keep in the office. I'll beat them up for you. All right? With that being said, any questions? Yes.
Now,
Yes, all right.
we've had Regence HMO and been very happy with it. But now we're concerned about the flexibility factor because it's tied solely to St. Al's.
Mm-hmm.
And I see a doctor at St. Al's, who's a neurologist. If she retires, I have to start looking.
Yeah.
And I want flexibility. I might have to go to a neurologist at St. Luke, for instance.
Mm-hmm.
There doesn't seem to be a lot of difference between the HMO and the PPO, just
Various,
copays.
yeah, variances and copays, pretty
But-
much.
But you have flexibility with this, where you could go out of St. Al's. If I need to go to St. Luke's, I can, right?
Absolutely, absolutely. That is the power of PPO, is you're not confining yourself to one particular hospital network. You're going to have more options. And you have the option to go out of network. So even if a doctor isn't in network, yes, you'll pay more if you go out of network, but at least you'll have some coverage. Whereas on an HMO, if you go out of network, the bill's on you.
And
So you
that's
got
where
it
the
really.
percentage is, where they talk about, like, they'll say for an office visit.
30%, something
Yeah,
like that.
20%,
Exactly.
Something like that.
Up to that. And remember, there's 2 separate max out-of-pocket limits. You have an in-network and an out-of-network. They are truly 2 separate. So you have
Gotcha.
8,900 for 50 for out-of-network and the 5,700 for in-network.
Gotcha, okay.
Yeah. So you will pay more, but again, it's about power of choice. And if that's the doctor you really want to see, then you don't have to wait a whole year to change your plan to get that particular doctor. You can get it now. Yeah.
Right.
So there is power in that.
Am I missing anything else? Are the same formularies for both?
No, they sadly are not always the same formulary. So we want to double check that. So I would just encourage you to send your prescription list over to our office. And then what we can do is we can say, okay, this is what your prescription costs are under the HMO, and this is what it would be under the PPO. And then that way you can do a comparison.
For the coverage of the drug,
Mm-hmm.
because I know the rates might be different, but with the GoodRx,
Oh,
that
yeah.
really changes the whole
It
playing
does.
field.
Yeah, it really does. And remember, you want to check if you are using GoodRx. Every time you go in for a refill, you want to double check the website because the prices change very frequently.
What about participating physicians? Are they the same for the HMO as the PPO?
Nope, there's going to be more physicians in the PPO.
There's gonna be more.
There's going to be more.
Good.
Mhm. Absolutely, yes.
I went into Fred Meyer one day and they wouldn't accept the GoodRx anymore, but they had an
Oh, yeah.
alternate plan.
Mm-hmm.
And I can't remember what they told me, but every time I go in, they take advantage of that other plan.
Yeah. Yeah, Fred Meyer has done some recent changes because they have their own plan, as you were mentioning. And if you really like Fred Meyer, it is worth it. Absolutely. But again, if you want to do a comparison against another pharmacy, then we can still compare it against GoodRx to make sure you're getting the best bang for your buck. But you're right. They did bring that in-house. Did you have a question? Nope. Okay. I just saw the,
Remember it all.
I know, it is a lot. These are recorded. That's why we have Levi here, a little tech whiz. And he's recording these so we can also send them out to you.
Can I ask you something? It's, the question I came here with, it has to do with the comparison between the two, or would you rather I didn't ask it now?
Go ahead. Yeah, let's see.
Okay. We've been with United Health for several years, and I worked for the government, for the court for years, and we have Blue Shield, and I really like them. They're a great company. But I'd like to know the main differences between, for the retired people, for us that are retired, the main difference between the two PPO programs right now.
Oh, I see. So for that particular question, I would give you the United Healthcare Summary of Benefits, and we can go over those specific, because there's a lot. Yeah, there's gonna be multiple areas where there's a difference. I will tell you that Regence is a local carrier. United Healthcare is a national carrier. What I mean by that is there's a local presence here within Regence. They have their main office in downtown Boise. They also have another corporate office in Lewiston, Idaho. When you call into customer service, you're talking to an Idahoan. United Healthcare, you may be getting the Philippines. So for those clients that are like, I don't want to deal with a language barrier, remember, hi, Shores Insurance here. You don't want to call customer service. That's our job, right? Our job is not just to help you find the right plan that meets your needs and budget, but to also fully service that for you and be a personal advocate and resource for you. So we can eliminate that barrier if you want to run your service request through our office. But I do want to just point out that Regence is considered local, whereas United Healthcare is going to have a national call center. We don't know quite where you're going to end up.
Does Regence cover US wide? Does it cover outside the country?
Yes. So all Medicare plans are going to have emergency and urgent care coverage nationwide and worldwide. Now, here's the difference though. So my little insurance joke is if it's an emergency anywhere in the country, no one cares where you go, just don't go toward the light. Insurance will pay for it, I promise. So if you're in California and you trip and fall, you go to the emergency room down at UCLA, no problem. That's going to be covered the same as if you were here in Idaho. They don't care when it's an emergency. They just want you to get the help that you need. Now, international is different. If you go to France and you show your Regence card, they're going to look at you like you have 7 heads. What the heck is an insurance card? They have national health care. So it's on a reimbursement basis. We highly recommend that you get a travel policy. We have a company that we really like to use called GeoBlue. And I'm not talking the travel coverage for your luggage and your flight and your hotel stay. I'm talking medical coverage, because otherwise a lot of these countries are going to require payment up front, right? Because there's no way for them to bill. So you'd have to exchange currency. This plan pays up front. It will bring you home if you need to come home. It will have pay for family to go to you if you need a family member to go to you. It pays for translation services, including translating your medical records into English for your American doctors. Huge, huge benefit, very inexpensive. It's called GeoBlue. So if you want to send us your travel dates, we can get you a quote like that. Not too long ago, we had a couple people that were gone for a couple weeks and they were able to spend less than $200 for their trip for peace of mind. So yes, Medicare will pay on a reimbursement basis, but I still highly, highly recommend that you get the travel coverage. It's just going to be a smoother experience. We had a gentleman from Blue Cross the other day come help us do our presentation. His name is Sean Taylor, and he described it really well. He's like, it's like the hotel concierge service of travel benefits. You're going to get people that are going to walk you through every step of the way. Like I said, they're going to offer those translation services. They're going to fully support and help coordinate everything so you don't have to worry about the bills. They take care of all of that. You just get to focus on getting better. Very nice. Great question. Any other questions? All right, I want to remind you of the dates. Annual enrollment period runs from October 15th through December 7th. Please get familiar and comfortable with these annual meetings. We want you to attend. How can you know if you want to change your plan if you don't know how your current plan is changing? Let's start with that. That way, when I do have a meeting with you one-on-one, you already know how your current plan works. Now we can talk about the other options and we really can do a deep dive in the comparisons, okay? So this is the time of year to make plan changes. You can change your mind as many times as you want up until December 7th. Your last enrollment submitted on December 7th is the one that takes effect in January. If you want to renew, you don't have to take any action. You are automatically scheduled to renew. Regence should be sending out new information with your 2023 benefits within the next month or so. Sometimes they don't like to send that out too soon, so you're not using the wrong card. If you want a one-on-one meeting, there are sign-up sheets over here on the table. If you know you want to renew and you want us to send you all the good stuff, all the materials, please see Heather in the back. She will verify your address and contact information and she'll get that out to you. If you're joining us online and you'd like a meeting, please send a chat to us online, or if you'd like to renew, we'll record that and again, send you your renewal packet. Thank you guys for your time. I really appreciate it. I hope you found this to be valuable and informative. We are here for you every step of the way. Don't hesitate to use us. Let's make it a great year, okay? Thank you, guys.
Thank you, Jenna.
Thank you.
I have a quick question.